Escherichia coli, E. coli, diseases, urinary tract infections, most common cause, neonatal meningitis, sepsis, traveler's diarrhea, enterotoxigenic strain, bloody diarrhea, EHEC strain, e.g. O157H7, UTIs, TMP SMX, nitrofurantoin or fluoroquinolones, sepsis meningitis, ceftriaxone, EHEC, supportive care, no antibiotics to avoid. Hinge 2, Klebsiella pneumonia, diseases, lobar pneumonia, current jelly sputum, nosocomial UTIs, liver abscess, sepsis. Ceftriaxone, carbapenems for ESBL-producing strains, check local resistance patterns. Proteus mirabilis, diseases, UTIs associated with struvite stones, wound infections, sepsis. Treatment, ampicillin, TMP, SMX, or cephalosporins. Resistant strains may require fluoroquinolones. 4. Pseudomonas aeruginosa, diseases, hospital-acquired pneumonia, UTIs, burn wound infections, otitis externa, swimmer's ear, endocarditis in IV drug users, hot tub folliculitis. Treatment, piperacillin tazobactam, cefepime, or meropenem. Add aminoglycosides or fluoroquinolones in severe cases. 5. Haemophilus influenzae, non-typable and type B, diseases, otitis media, sinusitis, epiglottitis, meningitis, Hib, pneumonia. Treatment, amoxicillin clavulanate for mild disease, ceftriaxone for meningitis, rifampin prophylaxis for close contacts, meningitis cases. 6. Neisseria gonorrhea, diseases, gonorrhea, urethritis, cervicitis, pelvic inflammatory disease, septic arthritis, neonatal conjunctivitis. Treatment, ceftriaxone single IM dose plus doxycycline or azithromycin for likely co-infection with chlamydia. Neisseria meningitis, diseases, meningitis, meningococcemia, petechial rash, Dieck shock. Treatment, ceftriaxone or penicillin G, rifampin or ciprofloxacin prophylaxis for close contacts. 8. Moraxella catarrhalis, diseases, otitis media, sinusitis, bronchitis, and pneumonia in COPD patients. Treatment, amoxicillin clavulanate, second or third generation cephalosporins. 9. Legionella pneumophila, diseases, Legionnaire's disease, atypical pneumonia with GI symptoms, Pontiac fever, flu-like illness. Treatment, azithromycin or levofloxacin, requires intracellular coverage. 10. Bordetella pertussis, diseases, whooping cough, severe paroxysmal cough with inspiratory whoop. Treatment, azithromycin macrolide, prophylaxis for close contacts. 11. Salmonella enterica, non-typhoidal, diseases, food poisoning, diarrhea from contaminated poultry eggs, septicemia in immunocompromised patients. Treatment, usually self-limited, fluoroquinolones or ceftriaxone in high-risk or systemic cases. 12. Salmonella typhi, diseases, typhoid fever, stepwise fever, rose spots, abdominal pain. Treatment, ceftriaxone or azithromycin, vaccine available for travelers. Shigella species, diseases, bloody diarrhea, bacillary dysentery, may cause seizures in children. Treatment, azithromycin or ciprofloxacin, supportive care for mild cases. 14. Yersinia enterocollitica, diseases, diarrhea, mesenteric adenitis, can mimic appendicitis, reactive arthritis. Treatment, usually self-limiting, fluoroquinolones for severe infections. SHA-15, Vibrio cholera, diseases, profuse watery diarrhea, rice water stools. Treatment, aggressive oral or IV rehydration, doxycycline or azithromycin to shorten disease. 16. Campylobacter jejuni, diseases, bloody diarrhea, associated with Guillain-Barré syndrome. Treatment, supportive in most cases, azithromycin for severe or prolonged cases. 17. Helicobacter pylori, diseases, gastritis, peptic ulcer disease, gastric cancer, and multiple myeloma. Treatment, triple therapy, PPI plus clarithromycin, amoxicillin, or metronidazole. Quad therapy for resistance, PPI bismuth plus tetracyclines, metronidazole. Brucella species, diseases, brucellosis, undulating fever, joint pain, hepatosplenomegaly, acquired from unpasteurized dairy or livestock. Treatment, doxycycline plus rifampin. 19. Francisella tularensis, diseases, tularemia, fever, ulcer, lymphadenopathy, acquired from rabbits, ticks, or aerosols. Treatment, streptomycin or gentamicin. 20. Pasteurella multicida, diseases, wound infections from dog or cat bites. Treatment, amoxicillin clavulanate, tetanus prophylaxis if needed. 21. Acinetobacter baumannii, diseases, nosocomial infections. Pneumonia, wound infections, sepsis, especially in ICU and ventilated patients. Treatment, carbapenems, if sensitive. Multi-drug resistant strains may require colistin or tigecycline. Would you like a